Well, joining me to discuss this is a medical doctor from Basildon University in London, Dr. Femi Oyekoin. Of course, it's good to see you join us on the world now at this time. Can you tell us what you see from hospitals in the United Kingdom?
Apparently, thank you. First, thank you for making me part of this conversation, Sarah. First, I just want to say that, the news is out that the hospital coronavirus case incident is beginning to at least is on the increase. At the moment, before the lockdown, before you know that the UK has been on a gradual reopening, just because the number of coronavirus cases here dropped down to almost very significantly or negligible numbers. But in the last 8 to 10 days, there has been a gradual rise in the number of incidents, in the number of cases, and also the number of severity. So that's what we are experiencing now.
But if you look at, so do you think a second imminent national lockdown will be imposed very soon? Because if you look at what is going on there, do people adhere to the safety precautions?
Adherence to safety precautions is usually a very difficult to swallow, because people crave for normalcy. People want to enjoy life, and usually it's not. It doesn't usually sink in a lot that people will have to hand washing, face masks, social distancing. Sometimes you need the media, you need the government, you need policymakers to cautiously enforce this restriction before people can start trying to make it part of their normal life. But you know that this lockdown is not part of our normal human existence. It was only meant to be for a short time. But the thing is, the fact that it's going beyond a short time, people are beginning to be wary of it, and it is likely that people may not be able to cope with it anymore.
So you say that could be irresponsible for the surge, is it?
Absolutely, absolutely, absolutely. You can't take away the fact that the surge, when you look at the fact that the restrictions have been eased, flights are coming from abroad, pubs are open, people like pubs, and by pubs I mean beer parlors and other joints where people use for relaxations are open. So in a way, with socialization and the fact that even if you have the virus, you may be asymptomatic, but you can still be spreading it. In a way, that has accounted for a significant rise in numbers. So these are all the factors that are possibly responsible for the new surge that we are seeing.
But interesting, just a few days ago, about 2 days ago, we saw the director of the CDC in the United States talking about the use of face masks, saying it is a more important public health tool than a vaccine. I want to get your opinion on this. Do you think a face mask, which is a preventive measure for diseases, could now stand as a curative?
Well, I'll say that I think it did. When an expert is talking like that, what he's trying to say is saying that, one, the fact that we don't yet know what the long-term sequelae of coronavirus is. And you know, like sometimes, like I think it was the last one I was talking about, Zika virus. If you're infected with Zika virus, the symptoms will be mild, but if a pregnant woman is infected with Zika virus, she gives birth to a child, the child will come back with some neurological deficit of deformity. Now, in coronavirus case, the long-term effect of what the infection is capable of creating, we don't yet know what it is. That's why it's advisable that rather than think that maybe if I'm exposed to it, I'll be okay in a couple of weeks, and then I have the immunity. What we're saying is don't even use the face mask as much as you can, especially when you are in public places, so that you're not infecting people and people are not infecting you. In a way, in a way, prevention is better than cure. That's what the CDC chairman was trying to say. But the other part of it is the fact that all the vaccines that are looking like possible solution to coronavirus, even with a lot of pressure from government and all of that, scientists are still saying that the earliest we can get a credible vaccine available for on a mass production level is still early next year. And when you look at the fact that this is September, we've lost almost 1 million people globally, and the virus is still on a rampage, it's still spreading. What can we do? The best we can do now is to, at this point, like in the UK, they're withdrawing on the lockdown. It is now reduced, like they're saying social gathering is now going to be limited to just 6 people, as opposed to 20, 30 as of last week. That has changed now. And these are some of the factors we're trying to put into play to say that face masks, social distancing, hand washing are still some of the best we can afford humanity at the moment.
But you know, when you come to Africa, especially here in Nigeria, what we see on the streets seem to be a bit different. You see people have gone back to the usual, abandoning the new normal, not even using face masks or, you know, trying to social distance themselves from other people. How do you think African governments should be taking this? Because they seem to be less fatality rate here in Africa.
Well, I know that the situation in Africa is peculiar, where people basically end their daily living on the streets. So it is going to be difficult for the kind of laws that apply maybe in US or in UK or Australia to become something that we want to encourage the government in Nigeria or maybe in South Africa to strictly enforce. Because the last time where the lockdown was imposed in Nigeria and Africa, and then you see politicians trying to make themselves popular through distributing what they call relief material. Some even went as ridiculously low as distributing popcorn. It was all over the media. What was popcorn going to do to a family man or a man with children? That's extremely ridiculous. But what I'll say is the fact that I know that for the first time we have very competent hands handling the CDC in Nigeria. The Minister of Health, his state counterpart, Senator Mamora, they are very seasoned, and these are not jobless politicians. I think they'll be able to look into how they can enforce public safety without jeopardizing people's ability to make their daily living.
Dr. Femi Eko, thank you so much for joining us on The World Now, and please do stay safe.
Thank you.